50% of people in the United States are not getting enough vitamin D. And new research shows that vitamin D could help with the prevention of cancer. Grassroots Health is calling on physicians, health clinics, and groups throughout the country to recognize the need for determining vitamin D levels and help put disease prevention at the forefront of public awareness through a new project called D Action. Dr. Cedric Garland is a professor of family and preventative medicine at the University of California, San Diego School of Medicine, also one of the lead investigators on this project. And you are here in town to help out with, actually, I guess a lot of the leaders in this, the forefront of this are in town today. What are you all going to be talking about?
Well, we're going to be talking about the near universality of vitamin D deficiency in people who live in cities such as Washington. Virtually all of us are vitamin D deficient. It's an amazing thing, partly because of our lifestyle. Now, if you're a lifeguard at Ocean City, you're going to be fine. But otherwise, chances are, with respect to cancer, multiple sclerosis, falls, fractures, you're going to be vitamin D deficient.
Can you talk a little bit about the correlation between vitamin D and some of the diseases you just mentioned? Why is it so important that we are not deficient when it comes to vitamin D?
Well, people who are deficient in vitamin D have 2 to 3 times the risk of breast cancer as the most important outcome, or breast cancer patients are twice as likely to survive the next 12 years if they have high levels of vitamin D. So if we were to isolate one group that it's most important for, it's breast cancer patients. But women in general are likely to have about 80% less incidence of cancer if they have an intake of about 1,100 IU a day of vitamin D and some calcium, or an adequate level in the serum. But the only way they can know is to do a test. And fortunately for us at this moment in time, there's a finger stick test that can be done. It takes a moment. You take a drop of blood, you send it into a laboratory, and you can get the results back. There's a voluntary organization, grassrootshealth.net, that does this. And it's amazing. All these things came together at one time. I think that's one of the big reasons we're all here in Washington.
Why is it that we're not getting, as a group, that we're not getting as much vitamin D as we used to?
Well, it's lifestyle. We're indoors most of the time. Everybody's busy. And in addition to that, when we're outside, we're either in a car, and ultraviolet light, which makes vitamin D, doesn't pass through glass. And the other thing is that we wear clothing that includes 92% or so body surface area. So the organ that makes vitamin D, which is the skin, is prevented from doing it by the nature of wearing clothing. But there's no alternative to that, obviously, except to take vitamin D.
A lot of the focus in some ways has been put on kids. You know, we see a lot of youngsters spend a lot more time inside, whether on the computer or video games, maybe not running around like we did when we were kids. Is that one way that we can get a little bit more, is just to kind of get outside and take advantage of the sunshine? And we should mention a lot of this comes from the sun, right? That's where we get it.
Well, 95% of vitamin D comes from the sun. So the simple answer is yes, 10 minutes a day, not a lot. You know, we don't need the sun worship. Although the maximum amount of area of skin should be exposed, consistent with modesty, to get enough vitamin D synthesized. But absent that, then oral intake of vitamin D works pretty well, vitamin D3, and that's readily available. Yeah. But it takes enough to do the job. It's at least 1,000 IU, even for children.
I know it's so tough because we're trying to prevent so many different things from happening to us. I think maybe to the point where we worry too much about some things. But obviously we hear a lot about skin cancer, and so people want to take protection, put on the sunscreen, and we slather it on sometimes. Is that keeping out the sun's rays when we might need them a little bit, though?
It absolutely is. It prevents the synthesis of vitamin D. So if you're wearing a sunscreen, you're not going to make a bit of vitamin D. So my advice on it is to keep the sunscreen in the pocket for the first 10 minutes. And if you use one, make sure it's got zinc oxide or titanium dioxide or some really real sunblock, not something that's clear. The ones that are clear are ineffective in preventing skin cancer, but they prevent synthesis of vitamin D. And that gets us at higher risk of multiple sclerosis, fractures, breast cancer, colon cancer, a whole litany of diseases that, because we're trying to prevent skin cancer, non-melanoma skin cancer, which only kills 2,000 Americans, we're losing the lives of 500,000 Americans who are getting cancers of internal organs because they are deficient in vitamin D.
Certainly a lot to digest, but I think the bottom line is if we can get ourselves outside for at least 10 minutes a day, get the kids outside, we'll be in better shape than we were before.
And get everybody tested so that you can monitor the levels and be sure that the exposure is effective.
Doctor, thanks for joining us. Best wishes the rest of the day in Washington. I know you're going to be talking a lot about this with more experts. I appreciate you passing along your expert advice to us this morning.
My pleasure, Steve.
Allison, back to you.